Welcome once again to my channel. Today we are going to look at calcium channel blockers and antihypertensive. So let's look at the mechanism of action of calcium channel blockers. So what they do is they interrupt the movement of calcium into the cells of the heart and blood vessels. If you want to know much about calcium's role in this mechanism, you have to go back and look at my video on fluid and electrolytes and calcium. So the main effect of this interruption is to decrease blood pressure, and that's our target. So this is done as a result of this drug being able to relax the blood vessels as well as decrease the heart contractility. Previously, when we started this whole topic, I actually pre-informed you that for the blood pressure to be elevated, there should be some issue with these structures: the heart, the blood vessels, the kidney, and then the brain. And then for these drugs to play this role, they have to aim at these structures. Right. So the calcium channel blocker category of drugs aim at the blood vessels and then the heart itself. And then play a role to decrease blood pressure by relaxing the blood vessels as well as decreasing the heart contractility. So the major side effects you have to take note of is cardiac depression, peripheral edema, and constipation. But I advise you more to focus on the cardiac depression for the fact that it's decreasing heart contractility as well as peripheral edema. Okay. Uses or the general uses of calcium channel blockers. We have hypertension, which is the main focus, and then we have angina and certain or some arrhythmias. Examples of these drugs are subdivided into two groups. Let's look at the first one. We have the dihydropyridine, which ends with ipine, IPINE. So these subgroups focus on the smooth muscles of the arterial blood vessels, and that's the work of vasodilation. Example being nifedipine, but with nifedipine has slight influence on the cardiac muscles, so it's usually avoided in patients with heart failure. Then we have amlodipine, felodipine, the last one being nimodipine, which has an influence on the brain. Usually its works over there is to actually prevent or reduce cerebral vasospasm. So on this slide, our main focus is going to be on nifedipine, which should be avoided in patients with heart failure, as well as nimodipine having extra function relating to the brain. So the second example subdivision, which is the non-dihydropyridine, we are looking at an example being diltiazem, having effect on the blood vessels, that's vasodilation. Then we have the heart, reduce muscle contractility. Then we have verapamil, which focus on only the heart, so reduce contractility of the heart muscles. So the main focus here is that since these heart and drugs have interaction, we are going to avoid these two drugs, the verapamil and the thiazide, or this subclass of drugs will not be used in heart failure, and relating to nifedipine as well in the other class of calcium channel blockers. So look at something you need to note about calcium channel blockers. So one, it's supposed to be avoided in patients with heart failure because it can lead to cardiac depression effect. Two, focusing on verapamil shouldn't be used with beta blockers because it risks the patient of having bradycardia and heart block. Alright, so this is all for today. Next time we'll continue on other classes of drugs which are used in hypertension.